Hi everyone, my name is Cara Statz and I'm from the JAX Laboratory. So over the next few minutes, I'm going to quickly introduce you to the JAX Clinical Knowledge Base, which is also referred to as CKB, and its novel feature of category variant relationships. So what is CKB? CKB is a relational database that can be used for genomic variant interpretation and aid in clinical decision-making in oncology. So what's in CKB? So within CKB, you can see there are multiple entities linked to one another. So we have over 1,800 genes and over 40,000 variants. CKB also uses standardized ontologies as well as controlled vocabulary, which provides uniformity and efficiency when searching for relevant information. So when we capture content within CKB, we link a molecular profile, which can consist of one or more variants, to a tumor type, a therapy, and a response. So when we look at drug labels, guidelines, or clinical trials, we often see that the biomarkers that are indicated are typically generic. So for example, for olaparib is indicated for ovarian cancer patients with BRCA1 or BRCA2 deleterious or suspected deleterious mutations. So in this case, we use a molecular profile of BRCA1 inact mute. In the case of guidelines, this example shows melanoma and lists imatinib for patients with activating mutations of KIT. And so in this case, molecular profile of KIT act mute is used. In an example of a clinical trial, so if we look at this inclusion criteria, it indicates that patients must have a qualifying mutation in IDH1 R132 or two different IDH2 mutations. So in this case, we use a molecular profile of IDH1 R132X. So how can category variant relationships help with identifying potential treatment approaches when you're looking at specific variants? So here's an example within CKB of a KIT exon 11 deletion, which is predicted to result in a gain of function. And if we were to look at the evidence in CKB for this specific mutation, we can see here on the left-hand side under Evidence tab that it's 0. There is no evidence. However, if we look to the right here at those category variant paths, we can see there are two different paths. There's a positional and a functional path. And so in this case, the specific variant within the positional path falls into KIT exon 11, and in the functional path, it falls within KIT act mute. And so then we can use these paths or these category variants sort of as parent categories to identify extended evidence. So here you see in the tab below for extended evidence, there's a KIT act mute with melanoma and imatinib. So for more information on these category variant relationships, as well as some visuals within CKB, such as the one to the left here, you can visit us at booth number 15 or go to ckbhome.jax.org, or you can also contact us at ckbsupport@jax.org. Thank you.